And on this topic of tolerability and safety trends, are there any that clinicians should be aware of based on real world use? Anything that you've observed that doesn't get talked about enough?
Sure. I don't want to monopolize, but you guys feel free to jump in. But I think that the discontinuation rate with the what I call the obesity protocols that Novo Nordisk and Eli Lilly were using on their medications is about a third of the patients had to drop out for having GI complications. And I think that our dropout rate it's less than 1%, but it has a lot to do with really doing much, much, much lower dosing. And that obesity protocol jumps up the dose, going to the maximum every single 4 weeks. And I think that there's a lot of people who are just overdosed on the medication. And so that, while they may not be the most severe complications, but if someone's going to be uncomfortable, they're uncomfortable and they're going to stop. So I think that is something that is significant and solved with dosing.
And Kelly and Dr. Olive, anything as far as safety and tolerability that jumps out at you?
Yeah, we aren't prescribing and we're not allowed to tell them to adjust their dose. But that's one of the big things that we'd also notice is people are jumping up on their dose as they're prescribed. And, like we were talking about just before with the protein discussion, they're ending up eating 800 calories a day because they just have too much medication. It's too much too fast for them. And then they're not getting the protein that they need to have a healthy, metabolism and keep their muscle and all of those things. So I do think it's more important than we realize to make sure that these patients are really monitored very carefully. The follow-up, we're not just dosing the way that they were studied, that we're actually taking the patient's clinical response to the medication into practice.